As mentioned in the introduction to Section 4, receiving care that is tailored to your needs can have a significant impact on both your experience of care and your quality of life, both physically and mentally. It is important that you are seen by the right people, in the right place, at the right time, and that you have the support and information you need when you need it. Neuroendocrine cancer is not a common cancer, and so specialist care may not be close to home. Specialised services are not available in every local hospital because they have to be delivered by specialist teams of doctors, nurses, and other health professionals who have the necessary skills and experience. Being diagnosed with neuroendocrine cancer can be a lot to take on board, not least the different words and terminology used. It's like entering a whole new world, a world of tests, appointments, and various discussions that can feel very bewildering, exhausting, and/or confusing, and we cannot tell you that we know how you feel right now or how you may feel as time goes on, but we at Neuroendocrine Cancer UK can offer support and information. Neuroendocrine cancer may not be diagnosed, treated, or behave in the same way as other cancers you may be more familiar with. Psychosocial support is centered around what your needs are when you need it. Being told you have neuroendocrine cancer may have come as a shock, not only if you've been feeling well and had been having tests as part of a routine health check or other reason, but also because it may be something you've never heard of before. On the other hand, your diagnosis may have come as some kind of relief, particularly if you've been feeling unwell, to find out that there is a reason why, even if the name is not something you're familiar with. The emotions you may experience at this time, the confusion and/or information needs you may have, may be varied and variable. You may feel anger, particularly if there have been delays in diagnosis, or you've been told your symptoms were due to something else, maybe even psychological. Disbelief, fear, and/or anxiety are also common and are completely normal responses to hearing you have cancer. Being faced with trying to get or take in the information you may need to make decisions about your care can be difficult, both practically and emotionally. Psychosocial support is an essential part of personalised care and can help you to deal with what may feel like the biggest challenge you have ever faced. Finding out more about your diagnosis, the tests, treatments, and follow-up arrangements that may be involved can help. Having a clear understanding of the aims and implications of treatment can be useful in helping you to make informed decisions about your care. It can also help to restore a sense of control. As human beings, we tend to like a sense of order. It helps us make sense of the world. Dealing with uncertainty and unpredictability can be difficult and take a lot of emotional energy. Knowing what is going to happen next, having a clear plan, for example, confirming your next appointment date, knowing what the wait time for results is likely to be, who you can contact if you have concerns or questions, can all help in reducing uncertainty and anxiety. Just remember that everyone takes in information in different ways, and it can sometimes feel especially confusing when medical terms and explanations are used, when simple, straightforward wording is what you need. Never be afraid to let your nurse or doctor know if they say something or use terms you do not understand. They may be so familiar with certain terms that it can be easy for them to forget sometimes that these terms are not used in everyday life. Take the time you need, write down, and ask the questions that are important to you. You can set the pace and don't be afraid of asking the same question more than once if you need to ensure you understand what has been said and what is planned. There is a lot of information about coping with cancer, especially online. This can vary from source to source and may not always feel relevant to you. Always check this information for reliability and accuracy. Ask yourself, where did the information come from? Is it a reliable source? At Neuroendocrine Cancer UK, our goal is to provide reliable, accurate information and support to those affected by neuroendocrine cancer. We work with our clinical expert advisory board, alongside our patient ambassador group, to ensure that our information is accurate and relevant, and with our counselling team, expert colleagues, and community members in developing and providing our support services.